Hello, everyone. Hello and welcome. I am doing a series on breast cancer awareness along with meeting breast cancer survivors and them sharing their story with us. So this is I'm thinking third survivor, Yvette Boileau-Lanni. And she's going to join us and talk about her journey. But first, I'd like to tell you a little bit about how Yvette and I met. So I was thinking about this, Yvette, and I think it's been almost 30 years, I
It
think.
has been, Joe. Yes, it has been. But we
30
might say
years
that.
ago.
It's only been 10.
Yeah, right. So about 30 years ago,
30 years
I was
ago.
looking to shadow a physician assistant because I was thinking about going to PA school. And that's when I found Yvette. And we became fast friends. And she also became a mentor to me as I was going through PA school. So she's been a wonderful friend, and I'm so happy to have her on today. And I'd like her to share some of her breast cancer journey with us. So go ahead, Yvette.
Absolutely. So, as Joe had mentioned, we met approximately 30 years ago, and just it was a blessing from God above. I was talking to Josephine a little bit earlier today about how God works his special ways in our lives. And really, we don't even realize the people we're going to need in the future from what we, meet in the present. So, Joe had called me, probably 6 months into my very, very brand new practice, and I was scared. And she said, I found your name through my dental hygienist, and I'd like to come and shadow you. And I'm like, oh heavens, I've just been practicing 6 months. I know nothing. But sure, Joe, come on along. I'm always very pro education, and I love my profession. I still love it as much as I did 27 years ago, and super, super excited to be still doing it today. So I'm going to tell you a little bit about my story. And it was a journey of faith. It was a journey of personal discovery. As I often think, God can give you some unfavorable moments in your life, but it is your choice with what you do with it. So, previous to my breast cancer journey, I had worked with a functional medicine physician, and that is a holistic physician. And I really led my life very holistically, eating right, exercising. I'd be in the gym 2 hours a day, approximately 19% body fat, didn't smoke, didn't drink, didn't even do food dyes, mostly vegetarian, and really loving that life and feeling amazing. And no family history of breast cancer. In fact, in 2004, I took it upon myself to do the big 60-mile breast cancer walk, and that was unbelievably amazing. And what a spiritual experience! But so, going about my life in 2015, I was a extremely busy PA. I was doing neurology at the time, working 7 days a week. I was raising my young son and really, loving life and keeping extremely busy. And I knew I had to get my mammogram, but being so busy and concerned for my patients, we doctors, PAs make the worst patients. So I kept putting it off, I have to admit, until a friend of mine called me, and his significant other, who was very similar to me in profile and so forth, came down with breast cancer. I think she had stage 2. It was a little bit different. And it kind of slammed me in my face. And I said, I really need to go. I really, really need to go. And I felt the move on my heart by God. I'm like, I really need to do it. I call it providential, but it was a calling. So thinking nothing about it, though, I went in and I went in for my physical, and I asked the nurse practitioner if I could have a mammogram script, and went over on a Saturday, of course, because I did not want to miss work, and went to Beaumont and thought nothing of it. And then a couple of days later, I got a call back, and I said they need additional views. Well, I wasn't too worried about it. It's pretty typical in our field, especially if they see something questionable. So I went back and they did magnification views. And I went in twice, and then I was sitting there, and I won't say, even as a provider, I won't say I wasn't nervous. So they call me back for the second view, and I'm waiting there. And then the nurse comes in and says, Yvette, can I see you back in the diagnostic room? And I walked in, and immediately my eyes went to the table, and I saw a brochure for a core biopsy. And my breath was taken away. I'm like, how could this be? I'm a vegetarian. I exercise. I'm thin. I don't drink. I don't smoke. I mean, I don't even touch alcohol. So all those risk factors that they always send you in the mail and outline, for you in the hospital brochures, how to prevent breast cancer. Well, I had done that and more. So come to find out, she was lamenting to me that they had found increased changes in my breast, primarily calcifications. And the interesting thing is cells that are cancerous die and they form increased calcifications. So I was like, okay, kind of took my breath away, but I'm a very steadfast person. And they set me up for my core biopsy. Went to my core biopsy with my husband, and even the interventional radiologist was lovely. And she's like, Yvette, you got this. This is no problem. We had a nice talk when I'm laying on the table, and she was wonderful. And Beaumont was amazing. And she said, I'm not worried. I'm not seeing anything suspicious. Not a problem. So I walked out of there and kept my head held high, and I was like, it's going to be fine. Went home. I was quite sore, but I went back to work the next day after some Motrin and ice. So the biggest challenge for me, though, especially as a provider, is I was expecting the results, and I got a call. I was driving on the east side of Detroit in an area called Chesterfield Township. If anyone is familiar with that, it's kind of like 696 on a Friday night. So I'm driving, and I got the call, and I knew I had to pick this up despite this being in 2015 when cars did not have, the Apple phone or anything like that tied into the car. I pick up the phone, and it's my primary care physician's office. It is a secretary. And she did not ask me if I was in a comfortable place or a safe place or with anyone of a loved one around me. And she proceeds to tell me, Yvette, we just want to let you know that we found cancer on your core biopsy, and we have an appointment with you for Dr. Pam Johnson in 2 days. And I was like, excuse me, excuse me. I said, let me pull over just one moment here. And again, very being pragmatic as I am, I pulled over into an insurance parking lot. I will never forget that. And I said, okay, let me get a piece of paper. And I copied Dr. Pam Johnson, who was amazing. And she did enclose by saying the doctor will call you, the nurse practitioner will call you that you originally saw, or do you have any questions? She said, do you have the information? I said, yes. And she said, okay, we'll be waiting for your consultation though. It was so cold and heartless that not the physician nor the nurse practitioner reached out to me to make sure I was comfortable, to make sure my questions were answered, to allay my fears, or even I was never asked if I'm in a safe place. I could have crashed my vehicle. However, God is good in all things. And 2 days later, I met Dr. Pam Johnson. She's now retired, but she was amazing. And I knew I loved her from the start because we had matching dresses. And I know it's funny, but when you go through something like this, you're looking for anything to make you feel good. She was amazing. She sat down with me. She told me what I had, which was DCIS, ductal carcinoma in situ, stage 0. Again, I was very blessed, but I was very angry. And I said, Dr. Johnson, I am a physician assistant. I have led my life to allay disease. And she said, it was a good thing you did, Yvette, because if you did not, this may have been worse. So she gave me hope. And from that point, I was introduced to Dr. Stefani over at Renaissance Spa, who became my plastic surgeon. From the get-go, I had no doubt in my mind, because there was absolutely nothing I could change, that I was going to elect a double mastectomy. In fact, in 2004, when I did the 60-mile breast cancer walk, I sat there in the camp looking at the signs thinking, if this ever happens to me, what would I do? And I knew from the get-go, I wanted the monkey off my back. I couldn't stop smoking. I couldn't stop drinking. I couldn't lose weight. I had no family history. There was anything, I couldn't change anything. I had no bad habits. I couldn't even stop drinking Diet Coke or Coca-Cola because I did not do any of that. So proceeding on, I went for my MRI. I did not have any regional lymph node enlargement. August 12th, 2015, I'm sitting in the surgical suite, pre-surgical suite, excuse me, looking at the clock and just ruminating, God is good in all things, which my priest had always said to me at St. Ephraim's, Father Ron, who's now passed, such a spiritual director of mine. I just kept on saying, God is good in all things, God is good in all things. So I went into surgery. By the grace of God, I went direct to implant. I did not have to do expanders. And I had an amazing experience with both physicians. I actually developed a huge hematoma the night of my surgery. Dr. Stefani had to come all the way back from Grosse Pointe to Troy Beaumont. He was the most wonderful, loving human being I've ever met. All I kept on saying in my clinical viewpoint, I'm so sorry, I'm so sorry. And he's like, not a worry. And, I was trying to keep some laughter during the whole thing. So I kept on saying, well, it's a good thing I'll be perky when I'm 90, and so just trying to keep a little bit of levity really helped. And of course, the day after I was discharged home, and I went home to about 6 weeks of recovery. Ice was my best friend as well as Tylenol. My husband was amazing. He's an engineer and does not like the sight of blood, but would drain my JP tubes. My little 7-year-old son would run and get me popsicles. And just the checkup and the follow-up and the support that I received was amazing. And 9 years later, I feel great. I won't say that I would have elected to do this. As Josephine knows, I still to this day really don't have a tremendous amount of sensation, even though I have some back. And it was not unusual for me or any woman that undergoes a mastectomy to kind of have an aversion to actually touching yourself. And that's a little personal, but it's a very strange sensation because these are foreign implants. And it took a long time to allow me to feel comfortable in this new body of mine. So I was very blessed, and I just think about, what could have been. I did seek a second opinion. Again, God blessed me with another student in 2003 who ultimately became the physician assistant for Dr. Cheryl Wiesen out of St. John's Macomb. I actually did a master's thesis on with them, which was really strange. So when Dr. Wiesen and Paula saw me for a second opinion, it was very ironic because I had really embraced breast cancer, as a mission, as both academic and professional. And so it was quite strange in that regard, but I was very thankful to seek a second opinion, and both aligned beautifully. I ended up going with Troy Beaumont, not for any like or dislike of anyone or lack of confidence. It just was closer to my home. And I felt more comfortable with my husband, with our 7-year-old, driving just a little bit closer. So, yeah.
Yeah. So yeah, that is quite a story, Yvette. And I do remember, of course, you calling me and telling me that you were diagnosed with breast cancer. And I remember how you were so distraught because again, she is
Mhm.
100% correct saying, I've never seen in all the years I've known Yvette drink a drop of alcohol, and she was the epitome of health. So to hear those words when she called me, I was just devastated because here's a close friend who, at that time, again, part of our story, again, talking about maybe divine intervention or how things happen in order. Yvette is the one who, that's where I started my volunteer work. When I wanted to do some volunteer work, she was the one who told me about
Mhm.
the Susan G. Komen organization. So I was with the organization at that time volunteering, and I thought, oh my gosh, now a good friend of mine is diagnosed with breast cancer. And, it just really, really hit home. And I thought, my goodness, this can really happen to anyone because
Mhm.
here's Yvette who, like I said, was the epitome of health. And it was shocking. And I remember you being very upset and also upset by the way, just
Mhm.
how you explained the story, how they told you.
Exactly.
So, being a clinician, being a physician assistant,
Mhm.
and being diagnosed with breast cancer and going through what you had to do as far as your surgeries and your recovery, how has this changed you as a clinician dealing with your patients? Has it changed you at all?
Mhm. No, it's a great question. It has. I feel very called by God to do what I do. Most clinicians will tell you this is such a mission of ours. It's a life mission. It's not a job. It's not even a profession. It is our mission. And I want to say I was always very compassionate and very empathetic with my patients. I had done and experienced other things in my past that really crafted my compassion and empathy. But since the time of being diagnosed, I've actually had several patients that I have had to tell them that they had breast cancer, one just about 3 months ago. And every time I tell them, I take a moment before I get into that room or on that phone, and I take a breath and I put myself back into their shoes. And I focus first on their behavioral and mental health because most of the times I am not the first one to tell them. They usually receive a call from Beaumont Hospital, and or they will now see it on my chart. So I have not been the one to break the news, but I am the first one usually to help direct and counsel them. So my first point is that most of the times the women are very distraught. The call to me comes within about 5 minutes of the call from the interventional radiologist. And so I take a big breath and I just remember what I was 9 years ago. And the fact is even though I'm not the surgeon, I'm not the breast oncologist, I'm the person that they can rely on. They can find compassion, understanding, support, and it's my affect that will give them guidance, strength, understanding, and persistence in taking this on and challenging it and really embracing it and taking it down. I found the whole experience, to be quite honest, very empowering because I was so angry. And I had a 7-year-old son, and I said, there is no question that this is not going to take me down. In a strange way, I found that really relieving because it allowed me to feel strength through this. At first, I did not. I felt very despondent, very lost. But once I found out what I was dealing with, the team I had, the confidence I had, and most of all, the support I had, I felt a combination of embarrassment, of strength, of empowerment. I can't believe how many cards I got from fellow friends, patients, family members. I had no joke, like 8 to 10 flower arrangements in my house. I was so touched and embarrassed that all the goodness I had given out, I received back. So that touched me in such a way that I wanted to spread that kind of compassion to those individuals who, at the very first moment, were feeling very alone, not sure, where do I go, and very scared. And what I do is I make sure I provide direction, very close follow up. Most of these patients of mine have my cell phone. They will just text me. I'm like, you are having a bad moment. You let me know. We talk, we sit, we have a little coffee clutch, and I tell them, you are in good hands. Just kind of take one day at a time. God's got your back. Lots of prayer, lots of fellowship, lots of support, and you will make it through as well. And by the grace of God, through individuals like Josephine, Komen, Carmanos, we have made such strides that things like DCIS or stage 1, stage 2, even stage 4, it's not what it used to be. And we can move on, be successful, use it to our advantage to empower other women, such as Josephine and myself, to feel that they can overcome this, they will be better for it, they'll be stronger, more resilient, and help others lift them up in their time of need.
Yeah, right. That's amazing. So I know, like I said, I've known Yvette for a long time, and yeah, it was a compassionate 27 years ago, but like she explained, as a clinician, but as she explained, when you went through this,
Mhm.
It even made you more aware and just more cognizant of what the patient is going through. And I think when you're going through a journey like this, you really need your physician, your PA, your surgeon to be really in your corner and try to
Mhm.
resonate with what you're going through because, initially you have that fear. And you did mention embarrassment.
Mhm.
And was it what was the embarrassment? What was that?
Sure.
Why? Why did
Yeah, the embarrassment was how, as clinicians, we don't think because we go through it every day how we touch others. We're very pragmatic, compassionate, but pragmatic. And we always think of ourselves as the strong one. And suddenly I became the patient. I
Mhm.
had to sit on a gurney in a gown, with no clothes on or very little clothes on. And I was embarrassed. And the other thing, what embarrassed me, and maybe embarrassment is not the perfect word, but touched, I guess, is how many people then turned their face towards me to help me. Almost to the point, like every day I was getting Vivianos at my door and cards and food and words of support. And I was just so touched by that I found myself almost embarrassed by the goodness and kindness of others. So,
Yeah. No,
yeah.
I can resonate with that as well.
Mhm.
And 2 years after you were diagnosed,
Yes,
I
Joe.
was diagnosed with breast cancer, and I
Mhm.
remember you were the second call I made
Mhm.
when I was diagnosed with breast cancer. And I'm wondering, what was that like for you to hear now your good friend being diagnosed with breast cancer? You had just gone through it 2 years
Mhm.
prior. What did you
Mhm.
feel when I called you and
Oh,
told you?
absolutely. And I remember distinctly being at a breast cancer symposium that day. And we were with Mitch Albom, I
That's
think.
right.
I think
That's
that
right.
was right. And we were at Henry Ford Macomb. And you had called me later in the day, and I was shocked because, like me, Joe, you were very, very healthy and very, proactive. And again, you had done so much work out of the goodness of your heart for this disease. And so I was blown away. But then again, I was so scared for you because that time period where you diagnose, but you don't know what to do, I was very scared. But in relationship with that, I was like, now I need to be there for Joe and help her in any way I can, whether it was by talking on the phone, whether it was being there, delivering food, whether it's taking to appointments, being a second ear, for an oncology appointment. What can I do to help you come out of this more successful, more resilient, and and like I say, making lemonade out of lemons. And look at what you have done with this. This is amazing what you have turned your, not so good situation into. How you have really taken it, embraced it, and are doing your best to spread the word of prevention, the love, the joy, the support. It's truly amazing, truly amazing. So I wanted to know that I could do the best I could for you in terms of making sure you didn't feel alone, you felt the support, and you too could feel that, God's hand was on you to empower, and that this is, this is going to end well. It's not an option to not end well.
Right.
So,
Yeah, and it was a blessing, just like you said about, by you being there and she did all what she said. She took me to an appointment. She listened to me
mhm.
many times and she gave me that strength because she had been through it. And that's so important where I talk
Mhm.
to people all the time and the importance of support, the importance of being
Oh,
grounded, whether it's your faith, whether it's meditation, whether it's, having that tribe of people around you.
oh,
It will get you through.
perfect.
It'll get you through.
Yeah.
And I'm grateful. I'm grateful for Yvette. And really, she really just helped me incredibly. And I'm very, very thankful to her. Um,
Mhm.
Now, with the DCIS, because I don't
Mhm.
know a lot about DCIS. Of course, when you were diagnosed, I did research it. And since
Sure.
then, of course, know a little bit more about it. But
Mhm.
is that a common breast cancer?
It is. It is. So ductal carcinoma in situ is exactly that. So in situ is a Latin term meaning encased in. So it is a type of cancer that is in the ducts. So ductal carcinoma, cancer of the mammillary duct in situ, which means it does not spread outside the breast. It's stage 0. What that requires is either a lumpectomy or a mastectomy. I elected for the mastectomy again because my risk factors were absent. I elected that, was very happy with that, never looked back. Some people will elect to do a lumpectomy with local radiation, and that's fine too. Some people want to do breast preservation, which I completely understand as well. And after the mastectomy, you have to, check up for 3 years in a row. And I won't say that my mastectomy is perfect. I should go back and do a little revision because gravity does settle things and things move. But overall, I'm very pleased with it. But yes, it is becoming more and more common with 3D tomosynthesis, especially because with the MRI capability now, with the 3D tomosynthesis, these dead cancer cells are degrading into what we call calcifications. And we are able, with precision, to see these in such a linear, a line-like fashion that these wonderful breast cancer specialty radiologists understand how to read it and say, so they jump on it before it is stage 1 or stage 2. Does it always happen? Absolutely not. But we are becoming more and more apt to find ductal carcinoma in situ because we have much better imaging.
Okay.
So,
yeah, that's a great explanation. Thank you for that explanation.
Sure.
Now, because you had the mastectomy, and they took most of your breast tissue, do you
Right.
need to have mammograms?
No, I do not, because 99.9% of my breast cancer was eradicated. The interesting thing is the way they take all the tissue. So this is not like when you go for a breast implantation for cosmetics, where they take the implants and put them behind the muscle. This is different, and it's a lot more invasive because the general surgeon will go in, the general breast cancer surgeon goes in to remove all the breast tissue. They then turn it over to the plastic surgeon. The plastic surgeon is the one that utilizes the implants, and they basically make sure they're aligned, make sure holistically you're looking normal, and which I did the first 6 weeks. You don't quite look well. In fact, my first week out, I went back and I said, Dr. Stefani, I'm so sorry. I look horrible. And he's like, Yvette, you are looking perfect. And I'm like, well, I'm glad you think so because I look pretty bruised. But they know by their expertise how you're going to look before you know. So, in that respect, I was very happy with the mastectomy. And then moving forward, again, you look great in a dress. I think I look better in a dress now than I did, beforehand. The only thing is that, the sensitivity is not there. I really did have to tell my husband, please don't even go into that region because they were so they were so numb for a while that it was actually painful. So, just a bit of an intimate thought there. It takes time and patience on your partner. So that being said, I would not though decide any differently. So very happy with that.
Right. Well, thank you. Thank you for that explanation because I know, sometimes people don't know, and I'm not sure. Yeah, I would hope that their surgeon would explain the sensitivity issue because they're cutting through nerve. Am I
Mm-hmm.
right? Yes, they're cutting through nerve, and that's
Correct.
what's causing this issue of not feeling.
Mm-hmm.
So I really appreciate these explanations because now we have, a medical expert. So I'm really,
Yeah.
I'm sure everyone is really appreciating, your explanations. But I appreciate the time that you've spent with me today. And
Absolutely.
I want you just to end our conversation. What one nugget of information would you like to share with those listening?
Mm-hmm. Absolutely. As I thought about it, number one, and I cannot stress this enough, is to get your mammogram. It really did save my life. I know it is not a comfortable experience, especially if you're a large-breasted woman. I know it's not, but I have to say I was small and it was not comfortable either, but it really did save my life. And the other thing I have to share with you is surround yourself with amazing supports, friends, family, fellow breast cancer survivors, and surgeons and clinicians. And find someone that is your surgeon and your plastic specialist, and make sure you feel comfortable with them. You have a good fit. It's kind of like when you buy, a wedding dress or you see a house. You have to feel they care, they're compassionate, and they're there for you. Don't accept anything less. I never returned to my primary care physician because that was a true statement of how their clinic runs. But I was lucky enough that I was blessed with Dr. Pam Johnson, who was unbelievable, and then Dr. Stefani out of Renaissance Spa. They were amazingly compassionate individuals, and just let people love on you, support you, love on you. As women, we are wives and mothers and sisters, and we always take care of everyone else. Take that time and allow them to love on you, and you take your time to heal and feel grateful and appreciate what God's given you. So,
Yeah.
yeah.
Yeah, that's great. Great information, great wisdom. I thank you, Yvette. I thank you for
Anytime.
joining us today. I thank you for our friendship. I am so
Thank
grateful.
you.
And I'm grateful for all the support and all the support that you give to your patients. You are a gift to
Thank you,
many,
Joe.
and we all care deeply for you. And just thank you for taking the time and explaining
Oh,
your journey with us
my
tonight.
pleasure. And thank you, Joe, for everything you do. I am sure you've saved hundreds, if not thousands, of lives by just doing what you do and
Well,
just paying
thank
it
you.
forward. Mhm.
Well, thank you
You're
so much. Well,
you're
everyone,
welcome.
until next time, we'll see you. Thank you. Bye bye.